So what SecurAcath does essentially is it stabilizes any type of catheter, any type of central catheter, without the need for sutures. When we put in sutures in patients, there's skin injury, there's pain, there's itchiness, and there's, higher risk for infection and problems when nurses are doing the dressing change. And really in my practice, where I work, the nurses really expect and demand a SecurAcath device in any type of central line because it makes their work easier and they're more confident with their competence at dealing with central lines and PICCs, and that translates to better patient care. Malposition is a huge issue, and that's how I was really able to validate and bring it in, justify bringing it in. I tracked it, and we had I think it was a 25 to 30% dislodgement rate, which is too high because that means there's 25 to 30% of our patients that were having issues that we had to intervene and sometimes replace the line. So bringing in an anchor, we have our displacement rate, malposition rate is, it's still less than 5%, so it's not zero, because you will still have those unpredictable patients that, whatever they do, the line will come out. So, but, when you go from 30% to 5%, I see that as a success. In my practice, we see it in the cardiac surgery patient population. So they're typically internal jugular CVCs post-op. So in that CSICU, it's extremely beneficial and helpful for the patients there. The other population is for PICCs, and that could be anywhere in the hospital. So they could be on medicine, surgery, mental health, renal, cardiac, general units. So it's extremely, what we see are the outcomes are so good because, again, they're well taken care of and easily taken care of, and the nurses feel confident in taking care of it. The third population is in-home infusion patients, so either for home IV antibiotics, and that could be short-term or long-term, or our home TPN patient, which is more chronic, so longer-term. It could be TPN, blood infusions, magnesium infusions, other types of IV hydration. It's really important that it's one line and that we're not doing multiple line insertions, and devices like the SecurAcath help with that, one line policy that we really want to adhere to for patient care.